Thank you for joining us for our webinar, First Timers Roadmap to Ambulatory Healthcare Accreditation. My name is Donna Rutkowski, and I'll be your moderator today. Before we get started, I'd like to go over a few items just so you know how to participate. In the upper right corner of your screen, you have a webinar control panel. You selected to join by either phone or audio or computer audio. If you'd like to change that selection, you can do that by accessing the audio pane in your control panel. We have two Joint Commission staff members with us today that will answer your questions. So feel free to submit a question by typing them into the questions pane of the control panel. You can send them in at any time during the presentation. We'll address them if we can during the Q&A session at the end. If we don't know the answer at the time, we'll get back to you offline after the webinar. A few days after today's webinar, you'll receive a copy of this presentation and a link to the recording via email. Today, we're going to introduce you to the team you have behind you every step of the way for ambulatory care accreditation and how they'll be helping you and your team go through the accreditation process. Valerie Henry is a business development manager for our ambulatory healthcare and office-based surgery accreditation programs. Katie Jacob is a senior account executive also for our ambulatory healthcare and office-based surgery programs at the Joint Commission. With that, I'll turn it over to our first presenter, Valerie Henry.
Thank you, Donna, and thank you to everybody for taking the time out to join us today. The business development staff are your initial point of contact. Whether you call in or email, you'll be directed to us for your initial information in getting accreditation. Initially, we'll obtain your organization's detailed demographic information, and there's a lot of questions that come back around this, such as location, etc. And the questions are typically, why do we need so much information? And it's due to the fact that there are variances in state requirements. An example is California requires an early survey process for ASC seeking deemed status. So again, based upon your state, there could be variances associated. We'll want to know how many sites you have. Are they functionally and organizationally integrated or operate separately? What types of services are provided? Are you providing sedation, general anesthesia? Do you have lab services or imaging services? All of these play into our understanding of your organization and help guide you into the best accreditation path and the segment your organization may fall under. We'll also ask about your annual patient visits or cases that you provide. This will give us an idea of, again, when we're looking at pricing, because that's always a question that comes up, where we can guide you to the pricing that your organization will fall under for the accreditation. And then we'll also take a look at and ask about your target application submission date. You may or may not know this at the time you call. Typically, on average, the application submission is 4 to 6 months prior to what we call your survey ready date, which is the day you are ready for a surveyor to show up and out. Surveyors may not always show up on that exact date, but they usually try within 30 days. So from that survey ready date, we usually say look back about 4 to 6 months prior. Now, we do have organizations coming in that have been planning and doing their policies and procedures prior to initiating a call that comes to the business development team. So you may move much quicker than that. And there are organizations that may take a little longer, and just know that your application is good for 1 full year. Next slide, please. I wanted to take a look at the eligibility criteria for ambulatory healthcare versus the office-based surgery. And the next slide, please. There's a lot of information on this slide, but I just wanted to highlight some of the initial sentences within. An ambulatory healthcare organization may apply for Joint Commission accreditation if the following eligibility requirements are met. The organizations in the U.S. states or the territories, the organization has facility license or registration to conduct its scope of services by law, can demonstrate it continually assesses and improves the quality of care, identifies healthcare services it provides services that can be evaluated using Joint Commission standards. And then these next ones are the ones that are a little more different than what the OBS is. The organization meets parameters for the minimum number of patients or volume of services required for organizations seeking accreditation for the first time or reaccreditation, and that is 10 patients served with at least 2 active at the time of survey. And your business development staff will emphasize this point, and especially if you're a new construction, new build, new startup, you'll want to make sure that before you have a surveyor ready date that you've served 10 patients with 2 active at time of survey. And then also the tests, treatments or interventions are provided at the organization are prescribed or ordered by a licensed independent practitioner according to state and federal requirements. Next slide, please. And then if we take a look at the office-based surgery, and I'm only going to focus on the right-hand side as the bigger differentiators. So for the differentiators with OBS is the organization meets parameters for the minimum number of patients, volume of services required for organizations seeking Joint Commission initial or reaccreditation, and that is 3 patients served with at least 1 patient having a procedure at the time of survey. So they're at 3 and 1 compared to the AHC 10 and 2 at time of survey. The organization is limited to business occupancy, which is defined as an occupancy that can have only 3 or fewer individuals at the same time who are either rendered incapable of self-preservation in an emergency or undergoing general anesthesia. So once you exceed that number, you would fall over into the AHC. You wouldn't be eligible for OBS. The organization must be surgeon owned or surgeon operated, and the organization provides invasive procedures to patients. So those are the differences between the AHC requirements versus the OBS. Next slide, please. Many times when organizations are coming in, your business development representative will ask, are you seeking deemed status if you're an ASC? A lot of times new organizations coming in aren't quite sure what we mean by that. And deemed status, the Joint Commission is designated by CMS as an approved accreditor for ASCs seeking Medicare initial certification. And we can provide accreditation and certification simultaneously through this process. But we also want to make note that CMS, not the Joint Commission, grants the final decision for Medicare certification. So we will conduct the survey. Our survey results are provided to CMS, and then they grant that final decision. And also, deemed status is not a requirement. That is a decision for the organization to determine. When you are seeking deemed status, you want to make sure you review your state licensing requirement for ASCs. You will complete and submit an 855B Medicare enrollment form to your Medicare contractor. And when you apply for deemed status, you must meet both the Joint Commission standards and CMS requirements. And when I talk about our additional a little later, you'll see that we do have a crosswalk available so that you can see the Joint Commission standards and the CMS standards simultaneously. Next slide, please. We get many questions around the pricing, and one of the things we do provide is a pricing worksheet, and that is based upon the segment we fall under and the volume, which again, I'll go back to the question we asked, what are your annual visits or cases annually? So we have a worksheet that we'll provide independently based upon this segment. We also provide a great high-level overview of the steps to accreditation. Which walks you through exploring your options. You'll call us or email us first. Reviewing the requirements, which includes we will provide a free 90-day access to our online standards, which we call the edition. We'll help you select the appropriate setting types. We will also schedule a separate time per your choosing if you would like for us to sit down and help you filter the standards to the specific segment that you will be surveyed under. We also have our standards interpretation group. The standards interpretation group are anything and everything our experts related to the standards. Your business development person will provide you their resource for connecting with them if you have questions around that. The other things that we can provide when we're in the edition standards I wanted to mention is we'll also help you for some quick tips into navigating the pages once you're in. Next slide, please. I wanted to pull this resource out separately because it's just a really wealth of information and preparation for organizations coming in, and that's our survey activity guide, our SAG. This guide contains information to help you prepare for the survey, a description of survey activity that includes session objectives, an overview of each session, logistical issues, suggested participants. The sessions are listed in the general order that they're conducted, and we also provide a document list displaying all documentation-based standards in one place, and it also includes a ready-to-go checklist. So again, it's an invaluable step-by-step process of how you're preparing for the survey, and just another great resource for you as you prepare. Next slide, please. The business development staff will also facilitate access to a secure portal that we call the Joint Commission Connect. You will be assigned your unique healthcare HCO ID, which is Healthcare Organization ID, which is unique to your facility and what you will use to access the Joint Commission Connect. Once you have access, you'll have your identified account executive that is assigned to you, and this also houses the application. And when an organization is ready to complete an application, the business development staff will provide a list either prior, or we'll walk through the application when you're ready to submit, but we'll provide a list of information to have at hand, such as ownership information, projected case volume, tax ID, number of licensed clinical staff, your survey ready date, what you want to know at that time. You'll get 15 blackout dates, which means the survey dates you do not want the surveyor to arrive, average number of hours open per month. And then once you make that application submission, you do need the application deposit of $1,700. Without that, the application will not move to the next level, which would be to go to our account executive. And with that, I'm going to pass the presentation over to our account executive presenting today, and that is Katie Jacob.
Thank you, Valerie. All right. So kind of like how Valerie kind of jumped me over for being your guys' account executive, and how we have basically described, we are definitely your go-to person for your organization. We are the main contact. You get just the one account executive. We help you with getting all your survey planned. We help you with anything pretty much pre, during, and the post-survey cycle, whether it be anything with your reports, whether it kind of help you with any policies or procedures, any specific questions, but we kind of want to help you with anything with it, whether it be education or resources to kind of get you ready for your survey. So we are definitely your go-to person for that. Next slide, please. So kind of how Valerie had described a little bit, you get your Joint Commission Connect access. I can't really stress this enough, how much Joint Commission Connect is definitely your main page of everything that you will need to kind of successfully get your organization ready for survey, and even maintain that accreditation and everything throughout your cycle for accreditation. Everything is on there, between your survey notifications, your agendas that we will post, if I have a sample of everything, any kind of survey process guide, helpful links, some resource documents and tools, which I'll kind of jump into a little bit further to kind of go a little bit more into detail within each of those. But definitely the Joint Commission Connect site is definitely your main platform that you want to kind of keep in tune with, check in once in a while throughout the week to kind of get all the basis of, for your organization for Joint Commission. Next slide. So this is the page of basically Joint Commission Connect when you log in. As you can see, we have them all kind of numbered there at the very top. For number 1, that's definitely where your organization name, your address, the HCO ID, which Valerie kind of explained. That's what your specific ID for your organization will be up there. If your account executive ever asks for it, that's where you would find it for sure. And you can even see my name is in here for this screenshot, that I am your account executive, my direct line, and that way you have easy access to kind of know if they're to kind of pinpoint who to talk to. And then the main kind of tabs I wanted to jump into was the survey process, our survey process tab. and then our continuous compliance tab. Those will definitely help you kind of prepare for survey. There's definitely a couple of information in there post-survey as well, but they definitely hold a lot of information in there to kind of get most of the components that you need to kind of get your accreditation going, and then definitely make sure you feel pretty well prepared for the survey. And then resources and tools in the security admin tab, those definitely will help you as well. Security admin tab is just where you can have your users from your organization. You can adjust their filters to what certain people can and cannot see. So you can definitely have anything as far as within there. If you go down to number 6, which is the what's due, this is again your main page. So anything that would be due down there, whether it be fees, any kind of submission that we need prior or post survey, that would be listed down there as well. So that way it'll actually have a due date as attached to it, or if it's overdue. So then that way you'll be able to kind of see what's coming up for your organization. For number 7, we have our official documents little link, along with number 8 is the important updates. Both have different things you definitely want to look out for. The official documents, that's where any of your reports from survey, award letters, any other important documents that we have posted for you within, again, it does say within the last 30 days, it does get saved within the system, which we can always kind of show you where it is. But then that way you kind of have easier access for it. And then important updates is anything we have posted for all Joint Commission organizations, as far as that we would want them to know any differences within Joint Commission. And then number 9, definitely a big one, notification of scheduled events. That's where if you do get the email that, hey, Joint Commission is coming, you can log into Joint Commission Connect. There will be a little bit, it's a little different picture than with this one. But this is saying there's no scheduled events, but then it would have a little link saying to view the scheduled events with the surveyor's name and info. And then that way you'll be able to kind of see a little bit more background into it. Next slide, please. So kind of jumping into a little bit of the 2 main tabs I feel like are the main components for a successful survey and accreditation with Joint Commission. The survey process tab, the main sections is the pre-survey and post-survey. Both obviously to kind of describe exactly when to use them. And Valerie had kind of gone over the survey activity guide, so that definitely is a big component that will kind of put you into the eyes of what a survey goes into detail for. And then the post survey, this is where you're going to find everything from your reports, your letters, anything from all of your pretty much plan of corrections after survey. And I wanted to highlight, this is also where you would also find your general application, whether it be you need to make any changes to the application upon submission if it is open to you, but you do have access to your general application even after submission. And then if you need to make any changes or anything to that, you would just need to reach out to your account executive. But the survey process tab, obviously you can see there's a lot of components in here and a lot of things you can kind of go within it to kind of, get a little bit more further information. But then the other tab is also the resources and tools tab. There's obviously just as much as anything that would kind of help you prepare for survey. Within resources, we have our edition, which Valerie has kind of pinpoint with it. We have our perspectives. This is where you have your certificates with everything. And then within the tool section, standard interpretation, that's a very big key, as Valerie has also pointed out as well. But everything pretty much within the tabs is going to be useful, everything that you want kind of wanting to look for. But you can always reach out to kind of get more information or looking for anything specific. You can reach out to your account executive to kind of gather any further information, that if you kind of are looking for anything that would potentially benefit for your organization before survey or even after survey. Next slide. So I want to take a little screenshot here of our actual application. We have it numbered again, same thing as what it was on the Connect site. Your organization name, address, and HCO ID will be up at the top. And then you do have 9 different tabs you go through. Each tab could have multiple pages, but we definitely wanted to highlight that each tab is different, obviously components that we kind of want to focus on. And then even if within each tab, there's this little G icon that's next to the 3, that's our little glossary that will kind of pinpoint if there's a specific area you're just not for sure what we are asking for or what kind of information we are kind of wanting. That way you can kind of click on that. It'll kind of go into a little bit more further detail, as long as also number 4, the help, it kind of breaks it down to exactly what we are needing from this page and why. And then we do have the useful links, which is our FAQs and full glossary there as well. We do have each tab broken down over here on number 6. Each tab will kind of change within which each link will generate. So then that way you can kind of click through each different page. And then obviously number 7 here is the previous and next. And then you can see the save button's it's not activated at that moment, but then that way you can kind of click through and see with everything within the application. So everything is very much laid out and detailed for strictly for ambulatory needs and everything that you would need. And then obviously this is the same view you would see as the organization as well as your account executive. So in that way, if you have any questions, that we'd be able to kind of assist you. Next slide. And Valerie kind of pinpointed this a little bit, the importance of having the application information to have it to having as much detail and very much up to date as best as possible when it comes time for your survey. You know, we definitely rely on that information within the application. It does determine the number of days for survey and then how many, what kind of type and the number of surveyors we want to send out there just based off the application. So whether it be the main address, which is where the surveyors would go, your ready date, which is really for the very first survey that you would get for your organization. The ready date is what we would kind of pinpoint for that. And then your volume, as much as Valerie has pinpointed, we definitely want to make sure the volume is accurate. Number of sites and services, our procedure days that you guys have for those sites and services, and hours of operation. Definitely want to make sure that those are up to date as much as possible and accurate, so that we are coming to survey on a right procedure day, at the right hours you guys are open, and also want to make sure that the number of sites is reflecting for the organization what's on the application. And then Valerie did pinpoint about also the void dates as being, we do have 15 days you get max. You always can talk to your account executive to kind of go over with that as well, but we just want to make sure that you have those avoid dates as best as possible to kind of make sure that we're not coming at a bad time for the organization. So make sure that, you know, we can successfully complete your survey. Next slide. So once you kind of go over application with your account executive, everything's good, they process it through. We do go through it with our scheduling team. The application will then be submitted, and then once after the phone call has been completed, we kind of go over it and send it over to our scheduling team. And then at that point, your organization is kind of based upon within, like I said, you have that ready date. Again, those are only for initials only. The scheduling will look at that as well. We'll look at procedure dates and also the avoid dates to take in accountability when the survey could be scheduled for. Organizations will probably receive a short date once it is scheduled. Again, that does vary upon the program and application information. You can always reach out to your account executive to see if that is something you would receive based upon what you have submitted. When it does come time for a survey, you do get a notification posted the morning of the first day, which is at 7:30 a.m. your local time, and letting you know that on Joint Commission Connect, that's where that surveyor information is at. But you do get an email notification the first day of your survey, and then that we kind of prepare for Joint Commission to arrive. Next slide. So account executives, we do give you a little bit of, to kind of give you an overlay of what, and for ambulatory, of kind of exactly what the day of for surveys would look like. We do give you some sample agendas. Surveyors do post and hand out more of their final briefing agendas, you know, to exactly what they would be wanting to do for survey. But these are some sample agendas you can kind of go through between the two. And you can kind of see between everything of just kind of some time frames and what to expect. And then that way you can kind of differentiate if exactly, you know, when to plan for certain events to happen. But account executives do give you some samples of exactly kind of how to imagine the day for the survey, as much as you also can kind of pinpoint it with our survey activity guide to kind of pinpoint it to that as well. Next slide. Same as for office-based surgery, we definitely do the same thing, just kind of giving each organization their own special agenda to kind of adapt to what they would be looking for within their organization for their standards and what to expect from the surveyor. So this is also just an office-based example. Next slide. So once survey is completed, you do get what we have is like a preliminary report. It's posted for about 24 hours. And then upon that, the report is actually sent to our internal team for review. And then you would get a final accreditation report. And I can go into more detail with that on the next slide. So within the final accreditation report, it will also have your scored findings, any follow-up events if those are needed, content of the final accreditation report, which is like any timeframes within there. And then with after as well, once your final report has been posted, you also will have access to what is your evidence of standards compliance. That is where you have most of your corrections of anything that you would need to do from any findings from survey to make them compliance for any future foreseeable surveys. And you do have an optional 10-day clarification, which that is tied to with our evidence of standards compliance. The 10-day clarification is kind of where you would need to submit any standards that you feel like you needed to have, you felt like you were in compliance with during survey, but then at the same time you kind of wanted to alleviate that to see if it still needed to be on the final accreditation report, but that's always optional. You can go right into the evidence of standards compliance, but then you can always speak with your account executive if you are thinking you need to submit a 10-day clarification. And then you also will get award letter and certificate after successful completion of the evidence of standards compliance and everything has been processed. Next slide. And again, kind of going to go into more detail with the final accreditation report. Everything then it is posted. It's within 10 business days of following the survey. The submission is then, within a submission of an acceptable ESC report, then you get a decision for your accreditation. Decision date, we have everything into their initial surveys with any RFIs, which is requirements for improvement. The effective date of the accreditation is the date on which the acceptable ESC is submitted. Resurvey with or without the RFIs, accreditation dates are effective the day after the last day of survey. The ESC is, if the ESC is acceptable when the organization has demonstrated resolution of all of the requirements of improvement. So once everything has been submitted, everything is in compliance, and then it is all in the resolution for what is needed, then that's when you would receive your final decision in the effective date as well for your organization for accreditation. Next slide. And to kind of continue within after survey, after you receive everything throughout your 3-year cycle, and even kind of preparing for anything in between to kind of help you within any compliance, we have what is called our intercycle monitoring, which is our focus standards assessment. I like to call this kind of like a checklist for your standards. It's definitely helpful for new organizations and any new employees for your organization to kind of go through and see what standards they feel like are in compliance or not in compliance. That way they just kind of can see what to look for within the day-to-day within the organization. eDition, which is what we kind of have touch base on a little bit, that does get updated twice, January and about June and July between there. We do even have like a what's new section, which is then from any update, you can click on the what's new section and it will tell you the differences from from that update from the previous to let you know what has changed. And it is by program for ambulatory, so then that way you can make sure what is actually specific for from one ambulatory update to the next. And then again, standard interpretation, can't stress them enough. They're definitely helpful if there's any standards that you feel like you're unsure of, if you're not quite confident if you guys are in compliance within the organization or whether you meet that compliance of what you're currently doing. Standards interpretation group is definitely the way to go and who to reach out to kind of help with that. You can always reach out to your account executive. They can refer to standard interpretation, but the standard interpretation group is a big key tool to kind of help with getting a successful survey. And then we also have like our monthly perspectives publication, which kind of gives us gives you some insight within Joint Commission and any changes and what's to come, especially for any ambulatory organizations and standards. Next slide. And I'm going to pass it back off here.
Thank you, Katie. And thank you, Valerie, as well. We're going to get to our questions. I see that we have some questions coming into the box already. But before we wanted to do that, we just wanted to highlight just a few more things just to help you along your way. We can't emphasize enough the value of the website. On the website itself, jointcommission.org, there is actually dedicated sections to ambulatory healthcare and office-based surgery. So please be sure to check there. But also, that's where you'll find the link to the standard interpretation group. We also have a section of the website that also deals with COVID, which and so while we're still under the public health emergency, we'll certainly have resources dedicated to ambulatory healthcare out there. There's actually a webinar on COVID for ambulatory healthcare coming up in February, and I believe one later in the year. So please be sure to check out the website to keep you up to date, along with the support that you're going to receive from our business development and account operations team. Slide, please. Before we get started, just two things. Just wanted to let you know, if you don't know how to get in touch with your business development manager, Valerie's presented today, but she also has some colleagues. So there's actually the email and the phone number to reach business development if you're just starting on the process. Slide, please. And then also, Katie spoke to the role that the account executives have. She has lots of colleagues that surround her for this team. So if you don't know who your account executive, we have a number that you can call, and you will get these slides and the recording within 2 business days via email. Slide, please. So let's start taking some questions. Our first question is actually, I'm going to ask Valerie to answer this. It's a great question. Valerie, one of our listeners likes to know where they should start with the process.
Start by contacting us. Utilize the information that was just provided on that slide. We'll get you aligned with the appropriate business development manager, and we'll take a look at where you are in the process. You know, calls come in where we're just identifying our site. We have questions about construction. We have questions about where we should be developing our policies and procedures. All those kinds of things we can support with resources to help you on the path to that. So reach out, and that's where we'll start gaining all the information that we need to facilitate you starting out.
Thank you, Valerie. I have a question here for Katie. Katie, who can have access to Joint Commission Connect?
Anyone can really have access to Joint Commission Connect. Anyone that has, if you are a security administrator, which would probably be more along the lines of the primary accreditation contact or the CEO, they can always add and remove any kind of access to users. And you can always reach out to your account executive to kind of assist as well. And you can adjust their security settings if there's certain things to see and not want to see. So, but anyone can really have access as long as they're added to their Joint Commission Connect organization's user account.
Thank you. Another one for you, Katie, if you can stay on the line. I believe this is for you. One of our listeners wants to know, what if our organization goes through a change mid-cycle?
Sure. Definitely reach out to your account executive if you are going through a change, whether it is something with deeming, non-deeming, if there's a site change, any kind of change that will definitely affect the organization. Reach out to your account executives to make sure you're doing the right path to make sure the change will reflect it correctly, and to kind of make sure that any upcoming survey or future survey will definitely reflect it correctly as well. So any specific change, just definitely reach out to your account executive so that we can ensure that everything would kind of pinpoint to that change, and kind of pretty much, especially with the application and anything within on our end with the database, that reflected for any surveyors or other users, to make sure that we can kind of navigate you through that.
Thank you, Katie. Valerie, I think this is for you. An organization wants to know when they should apply. Valerie?
Sorry about that, forgot to unmute. An average timeline is 4 to 6 months prior to your survey ready date. So once you have an idea of when you know you'll be ready for a surveyor to arrive, work yourself back. And again, an average is 4 to 6 months. It depends upon where you are as an organization. And as I mentioned, if you're a brand new build or you're searching for a site, your timeline may be a little longer. It could be shorter based upon the fact you may have already been doing upfront preparations and can move a little quicker.
Thank you. I have a question that I'm actually going to answer. We have a couple people asking if they're going to get a copy of this PowerPoint and the recording. Yes, you will. Today is Tuesday, so you can probably expect it by Thursday at the latest, but it will come via your email. Thank you. And there's more questions coming in. Let me see. Valerie, a question for you. How is pricing determined?
Pricing is determined based upon your segment and the annual visits. Now, the differentiator there is the office-based surgery. There is a flat rate on that. But in the other areas, we'll look, are you a diagnostic therapeutic, and what are your annual visits? Are you doing diagnostic telehealth surgical? Are you an ambulatory surgical with AHC occupancy? Are you doing surgical deemed? So those are all the variants. So it isn't a one price information that I can provide. And that again is when you call in or request information, reach out to us. We're more than happy to provide the information that will be based specific to your organization. But for everybody, there is the $1,700 annual or application deposit. That's probably the main staple for the initial fees up front.
Thank you. A question for Katie, see if you can possibly answer. One of our listeners asked so that they had heard that we are doing reviews over Zoom or online. Is that correct? And how do we sign up for it is the question. Would you like to handle that?
Yeah, sure. So it is correct. It is also ever changing. It is a new process, especially with this unusual past year. Best way to do is definitely contact your account executive directly and then that way to determine if your organization is eligible and go over the process and kind of what we're offering with the option. So it is best to reach out to your account executive to kind of go into more detail with it, but we are offering it. But your account executive can definitely go into a little bit more detail, especially since the process isn't always 100% structured the same every single time, but then we can always make sure that we're assisting to what your organization needs would be.
Thank you. I think looks like we might have one or two more that have come in. Valerie, can we add or remove deemed status mid-cycle?
I think Katie would be a better one to answer that one. If they're already accredited, if they haven't submitted for deemed the application yet, yes. But Katie, I think you're better to answer that if it's mid-cycle.
Yeah, no problem. And it kind of goes hand in hand with any updates. If you are wanting to do deemed status mid-cycle, you can, your account executive will kind of guide you to the process, especially the time frame of when your next survey for your triennial would be versus when you have to do your deemed status, whether you're adding or removing it. We do have a process to kind of get your accreditation started, whether it is adding the deeming status. If you're removing deeming, we just kind of need some more information and guidance to remove that from application in your organization. And then adding deeming, we just kind of go through a different process and survey policy to kind of get you into that. So we can adjust it during mid-cycle. It just, again, working with your account executive very closely to kind of make sure we're all on the same page and same track and make sure we're not overlapping anything or missing any information.
Thank you. And I think that's our last question. So I want to thank you all for joining us today and hope that you found today's information helpful for your ambulatory healthcare team. We want to thank you for all that you do for your patients. Have a great afternoon. Be safe and well.